sinuses are spaces in the bones in the front part of the face, in the forehead, between the eyes, in the cheeks and behind the eyes. And they're air-filled spaces with a membranous lining, and this lining produces mucus. The mucus drains from the sinuses into the nose through narrow openings and then passes backwards and down the throat. Now, if those openings get narrowed in any way, it causes sinusitis. So anything that makes the lining swell, such as infection or allergy, blocks the sinuses and they can't drain properly, and that causes the symptoms of sinusitis. Sinusitis can be categorized into acute sinusitis, lasting for days or weeks, or chronic sinusitis with longer lasting symptoms. Acute sinusitis usually occurs after a cold, which causes swelling in the lining of the nose, and this blocks the sinuses draining, causing symptoms of pain, throb, headache, sometimes a bad smell in the nose and bad taste, and coloured nasal discharge. Chronic sinusitis has longer lasting symptoms of nasal congestion, catarrh, cough, lethargy, headaches and pressure, which is usually in the forehead, between the eyes or in the cheeks. And these symptoms can have significant effect on quality of life. Individually, these symptoms do not sound so serious, but the cumulative effect has a big effect on quality of life, productivity at work, sleep quality, and effect on relationships as well. So the effect is quite significant. Sinusitis can be treated medically or surgically. Medically refers to treatment with medication and lifestyle change. The aim of medical treatment is to try and reduce the swelling in the lining of the nose and sinuses to encourage the sinuses to drain naturally so that the infection settles. This may involve a number of modalities. There are certain things that can trigger sinusitis, like allergy or environment, so this needs to be addressed. There are washes that can be used in the nose to irrigate the nose, to flush out mucus and infected discharge. There are medical drops or sprays that can decongest the nose, make the lining of the nose shrink down quite rapidly to improve the sinus drainage. But these are only safe for short-term use. For longer-term use, one can use nasal steroid sprays or drops, and these have a better effect using them longer term in the same way that one might use steroid inhalers for asthma. If allergies underlying the sinusitis, then antihistamines have a role. And antibiotics are obviously important in treating infective sinusitis. Now, if patients do not respond to medical treatment, then we have a number of surgical techniques to try and open up the sinuses and help them drain better. But these techniques have evolved such that they're performed in a very conservative way to try and help the sinuses drain naturally without destroying the natural function of the sinuses. The surgical treatment of sinusitis has evolved dramatically over the last 20 years, and even more so in the last 10 years or so. Traditionally, the treatment of sinusitis included washing out the sinuses, called an antral washout. And this was a very basic technique aimed at flushing infection out of the sinuses. But it rarely provided long-term benefit. Then an understanding of how we operate in sinuses evolved, and it geared towards helping the natural drainage pathways of the sinuses to work better, and to try and conserve normal anatomy to help the nose and sinuses function more naturally. And more recently, a technique called balloon sinuplasty has developed, where rather than removing tissue at all, we try to enlarge the openings into the sinuses by expanding a balloon in the openings to create a more natural sized opening without causing trauma and removing normal tissue. And the benefit of these new techniques is that the surgery can be performed as day case procedures, and more recently even under local anaesthetic sometimes, and the recovery can be much, much quicker. There's no need for nasal packing after sinus surgery now, which most patients found very traumatic in the past. You can go home the same day and return to work quicker also. Hence, the downtime after surgical treatment is much reduced and the recovery is much quicker.